Hello, everybody, and a very warm welcome to Nature Fit Doctor Speak series and podcast. Today, we are here to celebrate World Diabetes Day. It's 14th of November. India is referred to as the diabetes capital of the world as it accounts for 17% of the total diabetes patient in the world. As per ICMR, India has 101 million people living with diabetes, and it's gonna be 136 million pre-diabetics as of 2023. And a very interesting fact is that 50% of the people are unaware of their diabetic status. So it is more or less a pandemic which we really need to think about. And what better day than the World Diabetes Day to talk and debunk some of the common diabetes myths with our distinguished guest, Dr. Gaurangi Karmakar. Hello, ma'am. Welcome to the podcast. Introducing ma'am, she is MD Ayurveda Panchakarma, practicing since 22 years, a senior consultant, director of Tejasvi Medinova Private Limited. She has 3 Panchakarma centers in Thane and Dadar, Mumbai, named as Tejasvi Ayurveda and Panchakarma Clinic. Ma'am has been honored with many awards, starting with the Chief Minister Shri Eknath Shinde Sir as the best award as the best Ayurveda doctor, felicitated by famous film star Swapnil Joshi on behalf of P.N. Kargil Jewellers for Ayurvedic medical service in COVID-19, Jani Janardhan Seva Samiti Thane Award, member of Bharat Vikas Parishad and Indian Express Award, and many more. She also has international research papers on emergency management of high blood pressure with the help of Panchakarma therapy, and a national research paper on obesity management of Udvartana Chikitsa, an article on osteoarthritis management by Parisheka. A very warm welcome. And ma'am, we can just go on and on with your honors and with your achievements. So before we get into our question and answers, ma'am, we would like to understand that what is the different perspective of diabetes in Ayurveda.
Diabetes comes under Prameha Vyadhi told in Ayurveda. Prameha is of 2 types, that is type 1 which is called Sahaja Prameha in Ayurveda, and type 2 which is called Janmottar Prameha in Ayurveda. See, type 2 diabetes, we know it is due to the wrong food habits and lack of exercise, that is the sedentary lifestyle. So whenever we are talking about diabetes, it is very essential to know the management also. So if we see the causes, then only we are able to see the management part. So what happens in diabetes, that we will see first. What happens, whatever you eat, it converts into sugar. And this sugar is transported into the cell because sugar is the energy. So the patient feels energetic. But what happens in diabetic patients, this transportation of the sugar into the cell is done with the help of insulin. And in diabetic patients, there is insulin depletion and insulin resistance. So what happens, due to insulin depletion and due to insulin resistance, this sugar is not transported into the cell and it remains in the blood. And that is why the patient is labeled as he is having the diabetes. So in allopathy, what happens, they give the medicine to reduce the blood sugar levels in the blood. Okay, but what happens in Ayurveda, Ayurveda always work on the root cause. So sugar is not the culprit, insulin resistance is the culprit. So with the help of Ayurvedic Panchakarma therapies and with the help of Ayurvedic medicines, we remove insulin resistance. And when we remove the insulin resistance, then the body's mechanism, that is the transportation of this sugar into the cell, which is done with the help of insulin or by the insulin, it gets corrected. So the culprit or the villain is insulin resistance, which is removed with the help of Ayurvedic therapy, Panchakarma therapy, and that is how reversal of diabetes is possible. See, nowadays it is the latest trend that diabetes can be reversed. So it is not absolutely a new trend. In Ayurveda, it is stated already in the shlok. I will recite that shlok. Sarva eva pramehastu kalena apratikaranaha madhumehatvam ayanti tada asadhya bhavati hi. That means prameha, that means diabetes. Timely treatment of diabetes is given, then the diabetes can be reversed. And if these timely measures has not been taken, then what happens? It will end up into madhumeha, that is the uncontrolled diabetes. So diabetes is prameha and uncontrolled diabetes, that is madhumeha. And when the patient develops uncontrolled diabetes, then the patient develops the complications. That means the patient may get heart attack, the patient may get diabetic retinopathy, that means vision loss, diabetic nephropathy, that means the kidney failure, and even neuropathy, that means tingling sensation in nerves, or the patient do not feel like he's wearing some sleepers or anything footwear in his legs. He is not able to know all the things. So that is the patient may get non-traumatic diabetic wound, erectile dysfunction in males, and many more. So it is wise to reverse the diabetes at proper time.
Right. Perfect, ma'am. Like you actually explained, that the Ayurvedic perspective to diabetes is very different and it can be reversed. So going now, let's start. There are so many myths that are, kind of all around us, and this is the most commonly heard disease, that is diabetes. So there are these myths which we want to clarify today on the World Diabetes Day. So first is that eating sugar, जैसे आपने बताया कि sugar is not the culprit, but the insulin resistance is. So everybody feels कि यार sugar से ही diabetes होता है. It is so. What would you like to say for that?
Eating sugar can never develop the diabetes in people. It is the insulin resistance, which I told you earlier, that is the cause to develop the diabetes in patient. And one another thing which is very important, wrong food habits. That means the patients are eating carbohydrate rich diet, so it converts into sugar. So wrong food habits, lack of exercise, and another very different cause is there, that Bharatiya people, they have genetic predisposition to diabetes. So that is why Bharatiya people are more prone to develop type 2 diabetes.
Right. So when you say genetic, so it is because my parents have, so that is where I carry it in my genes. Is that the
genetic predisposition? That means we have the defect in our genes.
Okay.
What you have asked me, that is the heredity.
Hereditary,
Yeah.
right.
But all Indian people, all Bharatiya people, they have genetic predisposition to diabetes. That is why with if we are doing wrong food habits,
Right.
if we are living wrong, indisciplined lifestyle, it is very easy to catch the diabetes.
Oh, okay. That's an interesting thing. I did not know, because अभी तक हमने सिर्फ कि हाँ hereditary हो सकता है, wrong lifestyle, wrong eating habits, but this is a new one, that being an Indian, we have a higher chance of having diabetes.
Yeah, because
So
what
I think-
because what happens, each and every country, they are following the same lifestyle, or everyone is eating junk and fast food, but still the rate of developing diabetes in India is far more. It is just because that we are having genetic predisposition towards diabetes.
Okay, that's important. So I think we should take care of our lifestyle and diet and all even more, and take diabetes more seriously. Okay, so now they're going to the next myth that we have is diabetes is not serious. Type 2 diabetes is mild diabetes. So I have a few friends and all also, they are like, they are diabetic, but they continue to do everything very similarly, and they just say कि सुबह हम लोग एक गोली खा लेते हैं. So how serious is diabetes, and especially type 2 diabetes? थोड़ा आप उस पे कुछ
See, previously patients were facing some symptoms that they are having excessive hunger, excessive thirst, or such kind of symptoms, but nowadays patients are asymptomatic, so they do not bother, that they think, oh, I do have raised blood sugar levels, but I don't feel any symptom as such, so they just neglect the raised blood sugar levels. But if the raised sugar levels remain the same in the blood vessels, then what will happen? It will the end organs, they will not get the blood supply, and the patient may get heart attack, the patient may get stroke, the patient may get vision loss, or patient may get may land up into kidney failure. Such kind of complications develop in them. So it is really alarming. If you are having type 2 diabetes, you must have to keep the blood sugar levels in normal limits, or rather I would like to say reverse it.
So So you, as you like rightly mentioned, that it is serious and we have to treat it like respect it like a disease which needs our attention. Okay, going forward. Okay, yeah. So this one is a tricky one, and everybody is like, including me. I keep thinking about it. Diabetes only affects people with obesity, or is it one of the causes? So how is it? How correlation क्या है इनका?
See, lean patients also fall prey to diabetes, but obesity is the most precipitating factor for diabetes. When we are talking about obesity, we should know what is the ideal body weight. So, height in centimeter minus 100 centimeter multiplied by zero point 0.9. For example, if your height is 170 centimeter, so we will minus 100 from it, so it comes to 70, multiplied by zero point 0.9, so it comes to 63. So your ideal body weight should be 63. If it is more than 120% of the ideal body weight, then the person is considered to be overweight. So for these these obese patients are more prone for diabetes. So what Ayurvedic medicines like Triphala, they are very nice in giving in reducing the weight in kgs. Some treatments like Udvartana therapy. In Udvartana therapy, we are doing dry powder massage to the patient with a coarse powder. So what happens? The fat which is accumulated on tummy, on gluteal region, or on arms, it gets reduced. The fat is in semi-liquid form. So these powdered massage, these powder enters into the fat cell and it absorbs the material, and that is why the measurements reduces in inches and the patient gets the shape. So reduction in kg and being in shape, it is the most important thing for the patient, and it gives him the right personality and it keeps him away from all the metabolic disorders.
Right. I think obesity is one of the major causes for many of the diseases,
Right.
many of the lifestyle diseases that we have, and very strong correlation with diabetes, as you mentioned. Okay, going forward, I think this is the most, important part of trying to understand how to manage it. So, people with diabetes have to follow a special diet. Is this like is a fact or a myth?
See, diabetic diet is not far complete deviation from the normal diet. The nutritional requirements of diabetic patient is just same as that of non-diabetic subjects. Only the thing is that we are consuming the food like it is rich in carbohydrate, it is rich in protein, fat, vitamins, minerals, etc. So what happens when we are, that means non-diabetic subjects, they consume carbohydrate rich food. So what one has to do, if the patient is diabetic, he has to reduce carbohydrate content. For example, the patient is consuming 400 gram of carbohydrates, so he has to cut it down to 100 or 120. For example, what we are saying, chapati bhaji. Okay, so what? Just look at the tiffin box. The small tiffin is of bhaji or sabji, and the larger one portion, it contains 3 to 4 chapatis. But for the diabetic patients, what the diabetic patients has they have to do, they have to carry the chapati in the box where they have previously they were putting bhaji in it, and a larger portion should contain bhaji. So you have to reverse the proportion. That doesn't mean you have to do this diet, that diet, only the proportion should be changed. Right. So the right proportion, and your doctor always give you the right proportion as per the need.
Right, perfect. I think that's a very, बहुत एक होता है ना, दिमाग में रह जाएगा कि चपाती भाजी की जगह भाजी चपाती खाइए. And I think I heard Akshay Kumar also mentioning that rice or chapati should be the smallest portion in your entire plate. Yeah. And I think the only, and maybe India इसकी वजह से ये हम लोग ज़्यादा likely, because हमारा वो portion सबसे ज़्यादा होता है. Okay, so going next is people with diabetes go blind and lose their legs. So I think this is something मतलब सबको रहता है दिमाग में कि first step ये होगा, फिर retinopathy होगा, फिर amputation होगा. So is this like always the order usually, or
See, if the blood sugar levels they are absolutely in tight control, then the patient do not need to get scared about it. But what happens if the blood sugar levels are high? Then what happens? The glucose damages the internal lining of the blood vessels, and to repair it, cholesterol has to come and deposit over it. So what happens? The blood vessels, the lumen inside the blood vessels, it get reduced, and the blood vessels become narrowed. Okay, so what happens? The blood supply to that organ it is reduced. So just imagine the blood vessels of eyes, they are too tiny, and if it gets the lumen, if those gets narrower, then definitely patient will get blindness because of that thing. And the same thing with legs, the legs, the further portion of that leg, it may patient may need to ampute the toe, may need to ampute the foot if the blood vessel, if the blood sugar levels are not in control. And for this, Ayurveda is having beautiful management. That means amla powder and haldi powder, if it is mixed together, then it protects the internal lining of the blood vessels. And Shilajit is one of the drugs which is very useful in preventing this peripheral vascular disease. Because of that, a patient need to amputate a leg, so that Shilajit helps a lot in protecting your leg. And amla powder and haldi powder is very useful in protecting your eyes. So absolute tight control of blood sugar levels is mandatory.
Right. So I think absolutely, this can be prevented. एंड वही हम लोग आज वर्ल्ड डायबिटीज डे पे सब लोगों को यही बताना चाह रहे हैं कि आयुर्वेदा लाइफस्टाइल लाइक द होलिस्टिक अप्रोच इफ टेकन देन वी कैन आई अंडरस्टैंड दैट देयर इज एक सीक्वेंस है. अगर आपने कंट्रोल में नहीं रखा, पहले आप दवाई खाएंगे, फिर आप इंसुलिन लेंगे, फिर आपका रेटिना इफेक्ट होता है, और फिर मे बी अनदर ऑर्गन. And this entire process can be saved if we are just adopting Ayurveda as well as simple lifestyle changes. And as you said that हम कुछ transformational नहीं मांग रहे, हम बोलते हैं ना कि आप सर पे उल्टे खड़े हो जाओ, ऐसा कुछ नहीं है. It is very simple changes that you are expecting. Okay, going to the next one, pre-diabetes. As we, in the starting of the podcast also, we said that almost 154 million people are pre-diabetic and they are expected to be by 2023. And 50% of the people are not even aware of their diabetic status. So, pre-diabetes always leads to diabetes. Like, is that a myth or a fact?
See, why the patients are diagnosed as pre-diabetic? Because of their wrong food habits and sedentary lifestyle. And if the patient corrects that one, then definitely he will not and end up into diabetes. So for pre-diabetic patient, it is very wise to adopt the right food habits and disciplined lifestyle, so that they can lead the life, they can live the life to the fullest. Right. And if the patient is continuing the same lifestyle, after say within 5 years, he may end up into diabetes.
Right, true. So हम डायबिटीज को भी रिवर्स कर सकते हैं, हम प्री डायबिटीज
absolutely pre-diabetes is the main they should come first to reverse it.
So I think pre-diabetic जैसे ही हमें identify हो कि we are pre-diabetic, I think most of the things that you mentioned should start as a process. Okay, going further, so this is very important because people with diabetes, they shouldn't, because being natural में हम लोग बोलते हैं fruits खाइए, fruits कितना भी खा सकते हैं. So what about diabetic patients? Are they allowed to eat fruits, and what is the portions, or how much, or what type of fruits can they consume?
If their blood sugar levels are absolutely within normal limits, then they can have fruits like papaya, apple, watermelon. See, most of the times people think that watermelon is having high glycemic index. So some people, they do not advise to have watermelon, but it has the moderate glycemic load. So watermelon can be consumed by the patient very safely. So having 1 or 2 slices of fruit, it is advisable in diabetic patients if the blood sugar levels are absolutely within normal limits. But if the patient is having fatty liver, then we always advise to stop eating fruits.
Okay. So there is again a combination of the health condition which will allow or not allow the eating of the fruits. So as Ayurveda always says, customized to the person's current condition. Okay, so this is actually something to laugh about. Diabetes is contagious.
Diabetes is not contagious, it is hereditary. But again, I would like to say, if your mother is diabetic, that is, if mother is having type 2 diabetes, then certainly you may develop type 2 diabetes as it is hereditary. But again, if you correct your food habits, if you correct your lifestyle, then definitely it just forget about the diabetes.
Right. So I think we corrective, preventive, everything works on that, yeah. And the best thing again, always I say about Ayurveda and the lifestyle changes they recommend or the holistic approach, it will not only help us in diabetes, but overall, none of the other diseases will also be able to affect us if we are taking care of what you have suggested. Okay, yeah, this is, I think, in COVID, we all saw that the people who actually succumbed to COVID had a comorbidity, or, they had and most of them, like, we also had some data which said that most of them were diabetic. So, people with diabetes are more likely to fall ill or, get another health condition. So,
Right. See, diabetes is a pro-inflammatory disease. So, if the patient is having diabetes, definitely they can catch the infections very easily. So, it is always advisable to keep blood sugar levels in tight control. And in Ayurveda, always suggest you reversing the diabetes. So, it is really very wise, because as the age advances, though your blood sugars are in tight control, but apart from this, also patient develops complications in their further life. So as you grow older and older, at the time what happens, if the patient, non-diabetic patient, if he is having pneumonia, that means a person who is having 70 years old and he is not diabetic, and if he gets pneumonia, then he will get recovered soon. But the diabetic patient who is having pneumonia, so it is really fatal for him. So it is really advisable to reverse the diabetes.
right. So I think this is what we all saw in COVID, that there were young people, very young in age also, they succumbed to COVID. They it became fatal because they had this diabetic condition. Okay, so coming to our last myth, and this is again something which many people want to know, is one can stop taking diabetes medicines once the blood sugar is in control. So what is that? वो कौन सा कट ऑफ पॉइंट आता है जहाँ पर, और क्या ऐसा है कि एक डायबिटिक पेशेंट के लिए हमेशा के लिए दवाई छूट सकती है और दे हैव टू लिव विद इट?
Okay. See, first of all, diabetes is not a disease. For example, a patient is suffering from TB or pneumonia and he is consuming medicine for the same, then he is free from TB or he is free from pneumonia. So, diabetes is not a disease, it is a disorder, it is a defect mechanism in your body. So, with the help of oral hypoglycemic pills, you can manage the sugar levels. But once your sugar level comes in normal limit, it is not advisable to stop the medicine. Okay, so if you stop those medicines and you are already asymptomatic because you are not suffering from any symptoms, so what will happen? You will never notice that your blood sugars are again increased, and you may land up into complications. Okay, so patients should not discontinue their diabetes medicine if though the blood sugars are in normal limit. So they have to rush, they have to contact their doctor and they have to just get the dose reduced. Okay, but if patient wants to stop those medicine, then patient has to come for an Ayurvedic treatment where we are removing the insulin resistance, which is the cause for the diabetes. And when the insulin resistance has gone from the body, then definitely the defect mechanism will get corrected and the body will able to manage the sugar levels on their own. So Ayurvedic Panchakarma therapy, Ayurvedic medicines, right food habits and disciplined lifestyle, exercise, all these things reverse diabetes and keeps your blood sugar level absolutely within normal limits without any medicine.
Great, great. I think what a marvelous note to end the podcast कि आपके पास एक ही solution है, और वो है आपने बताया Ayurvedic way of treating it, as well as the lifestyle, as well as diet. And we have to, either we want to take medicine for the entire life or we want to follow the discipline for the entire life. I think it is our choice. So thank you so much, ma'am. Thank you for joining us on this World Diabetes Day. and I'm sure the inputs will be taken up by our viewers, and some of them actually they can actually consult ma'am. She is on our platform Nature Fit, where we connect you to your nearest Ayurvedic practitioner, homeopathic practitioner who try to heal you naturally.